All right, guys, so I have shared this information before, and I don't have expertise in this area. If you want expert opinion, please go to Nancy Beckley. Go to nancybeckley.com. You can find information and hire her as your consultant. The best I can do is say, look, this is the LCD that I'm looking at. I'll provide the link in the resources below this video. I know that there is, so here, let's start right here. Miscellaneous services non-covered, right? The following are non-covered as skilled therapy services. This is not an all-inclusive list. So if we scroll down through here, couple, like obviously you see what I highlighted, but you know, other things like driving assessments are not covered, hence they could be self-pay. Craniosacral therapy, continuous passive motion device setup and adjustment. So Medicare does pay for the CPM after a knee replacement or something like that, but it doesn't pay for the setup and the adjustment of the device. Massage chairs, roller beds, dry hydrotherapy massage, low laser, anodyne, ionophoresis, except as indicated for primary focal hyperhidrosis. I don't know. Anyway, this is the topic for this video. Pelvic floor dysfunction. Now we know Medicare does cover incontinence issues and some other pelvic floor related issues specifically related to or deriving from low back issues. But here, so due to the lack of peer-reviewed evidence concerning the effect on patient health outcomes, skilled therapy interventions, for example, ultrasound, electrical stimulation, soft tissue mobilization, and therapeutic exercise for the treatment of the following conditions is considered investigational and thus non-covered. Pelvic floor congestion, I don't know what that is. Pelvic floor pain not of spinal origin. This is the most frustrating, I think, for so many therapists who are working on this. There's a couple others like vulvodynia. I know a lot of therapists who work with that, but you know, I don't know. This is what's going on. So what I would encourage you to do, if you're a therapist in this world, in this niche, open up this LCD. Go ahead and take a look at, you know, hit Control F and take a look at some of the covered services. Like here, there's some biofeedback stuff that is covered. Pelvic floor electrical stimulation, lacking documentation of failure of a trial. We jump up here. There were some other things that I was looking at. Again, biofeedback for incontinence. Non-implantable pelvic floor electric stimulation. So, you know, there is a lot of stuff that is covered. You guys are the experts here. I mostly just wanted you to see what is non-covered. And, you know, this to me opens the door for a hybrid model. This means that Mrs. Patient, these are the services that Medicare will pay for. These are the services Medicare clearly lists on its list of non-covered services. If you would like this treatment plan, the total cost is this. This portion of it is paid for by Medicare. This portion of it would be paid for by you. And then the client can decide. And if they say yes, you have an ABN. You indicate the reason why is because it's listed as a non-covered service. LCD, you give the, let me jump up here, you know, L34049. You got like this one here for services performed on or after 5/27/2021. You've got your reference to cite on why those services are not covered and why the patient is paying cash. So I would use an ABN in that situation, but I think you've got the resource here. Now, not every MAC follows every LCD. Each MAC might have their own policy, so you would want to take this, go to your specific MAC, find out if this is what they're going by or if they have something else. Guys, I hope that's helpful. I'll continue to share these little bits and pieces of useful information. My goal here isn't to necessarily educate. Again, I'm not the expert. It's to share the resources and let you go find the information for yourself to develop your own internal policies for your business. Catch you later.